Despite the fact that I had a very healthy baby, he was colicky for the first 3 months of his life. And so it was constant crying. And by month number 4, he wasn't just colicky, he was starting to develop something else. It was acid reflux.
I was super concerned when my baby got sick. I didn't know what to do. I didn't know if I was in the right city. Maybe I had to move with my other kids to Houston, put him in a nice hospital.
He was just crying every time after feeding, and I'm like, what's wrong?
What they do, all these pediatricians, they instruct you as to medication. And finally I said, look, I've had it with the medication, what can I do? They referred me to a pediatrician, gastroenterologist, and that's where Dr. Spinetti comes in.
I tend to see a lot of patients that they have this significant reflux, but the major reason why they continue having reflux and also why they are not responding in a perfect way to, let's say, reflux therapy, if we find the reason, is because most of them continue to have large volume feeding, so we call overfeeding. If you have a glass and we put more water than the glass can contain, the glass spill. So the concept is very simple.
Now there's a better solution. Introducing Dr. Spinetti's perfect feeding bottle.
Regular bottles, they just care about the nipple of the bottle, but they don't care about the bottle itself. They just want the baby to feel comfortable when they drink it, but you can put any amount of milk that you want.
It all had to do with education, how much you should feed a child. I was feeding him too much, and he told me the amount that you should feed for the weight the child was in.
Babies comes to my office with frequent spitting up, vomiting, colics, diarrhea, and sometimes just with the use of this bottle, where I usually explain parents how to use it, how to calculate the volume, most of the problems are solved.
The bottle is amazing because the bottle has a relationship between the weight of the baby and the amount of milk you need to give him. You just follow the bottle, the direction of the bottle, and you will be fine.
You don't have to be searching on the internet. You don't have to be calling your doctor, making calls that are really not necessary when it tells you on the bottle how much you're supposed to feed your child.
I use it every day because I measure exactly and I adjust by his weight at the pediatrician's office.
It helps the baby not spit up. It helps the baby not have colics.
This bottle, what it does, it has a measurement chart. And in the measurement chart, you have the baby's weight and the ounces. So every time you go to a pediatrician and have your baby's weight, you can go ahead and measure how many ounces he can be taking.
Depending on the child's weight, how many ounces you are supposed to feed your baby and for how many hours.
As soon as I started incorporating the volume of what the child should eat, he got better just like that.
I've had a father who has come in here and personally given me the thanks, because when his wife leaves and he's at home with child, he knows how much to feed his baby. He knows he's not overfeeding his son or daughter. He knows he's doing the correct way.
As a pediatrician, we really believe in preventive medicine. So preventing medical problems, it should be really our role in the community. And this bottle will prevent multiple visits, multiple problems in the baby. And I think that this bottle will even decrease the frustration that some parents have.
It's self-explanatory basically, and it's a very good product.
It is something I think no mother should be without.
It's like it worth when the family see you in their eyes and they tell you, I definitely see that my baby is doing better, and I cannot understand why just adjusting the feeding was the way to go. Now I understand that, and then at that point when you start catching, there is something like you feel rewarded. The word is rewarded.
Dr. Spinetti's perfect feeding bottle. For more information, visit perfectfeeding.com or call 956-682-2244. Sponsored by the Pediatric Gastroenterology Clinic of South Texas.